Welcome to the Health Insurance and Pharmacy presentation for retirees, a health insurance topic. By the end of this presentation, you will be able to enroll in group health insurance program coverage if eligible, choose a plan design, choose a health plan, find an in-network pharmacy near you, and find resources for more information. Let's start by diving into group health insurance program coverage by looking at who is eligible, how to enroll, finding your employer's health plan information, the monthly cost, and uniform benefits. Eligibility is slightly different between state and local retirees. State retirees are eligible to elect the medical coverage of their choice. However, local retirees are eligible for the program that their last employer offers. Both state and local retirees may enroll during the open enrollment period or a life-changing event such as marriage. All retirees enroll in health insurance coverage by completing a health insurance application change for retirees form number ET 2331. That form is then submitted directly to ETF. Go to the Health and Pharmacy page on the ETF website to find your health benefits information. If you are unsure if you are considered a state or local retiree or what medical coverage your last employer offered, use the Benefits Available to Me page and type in your most recent employer's name to find your health program option. If you know your program option, you can go straight to your health information in two different forms: the Health Benefits Decision Guide or the Available Program Options page. You can find all three of these options on the Health and Pharmacy page. The cost of your premium is determined by a few factors. The main factor is the plan design you choose. For locals, your plan design is limited to the one your former employer has chosen. Your monthly cost is also affected by the type of coverage you choose, individual or family coverage. All group health insurance programs have uniform benefits. This means there's a standard set of covered procedures and services available to all group health insurance program members, regardless of employer or plan design option. For example, emergency care, mental health services, and preventive care and immunizations are all uniform benefits. Please note that Medicare offerings may have different benefits depending on the plan design. Now we'll look at how to choose a plan by looking at plan designs, how to select a health plan, and finding pharmacy information. As I mentioned earlier, the cost of your monthly premium is mainly determined by your choice of plan design. A plan design determines how much you pay per month, how much you pay when you visit a provider, whether you can see providers locally or nationwide, and if you can see providers out of network. If you are a state retiree without Medicare, you have the option of 4 different plan designs, all of which have different premium costs. The High Deductible Health Plan, or HDHP for short, offers local medical coverage in the state of Wisconsin. It also has a higher cost when visiting providers, but a lower monthly premium. A health savings account, or HSA for short, is required for this plan. The IYC Health Plan also offers local medical coverage in the state of Wisconsin. It has a lower cost when visiting providers, but a slightly higher monthly premium than the High Deductible Health Plan design. The Access High Deductible Health Plan, or Access HDHP, offers nationwide coverage with out-of-network benefits at a higher monthly premium. A health savings account is required for this plan. The Access Health Plan offers nationwide coverage with out-of-network benefits at the highest monthly premium. A quick note about those HSAs. Health savings accounts are required for high-deductible health plan participants only. To be eligible for a health savings account, you cannot have any other health coverage that pays out-of-pocket healthcare expenses before you meet the HDHP deductible, including Medicare Part A and B. Retirees that opt out of the HDHP but keep an HSA open and active with Optum will pay a monthly administrative fee. Retirees enrolled in the HDHP HSA benefit option are not required to pay the monthly administrative fee. Local retirees without Medicare can find their plan design by going to the Benefits Available to Me page on the etf.wi.gov website. Type your last employer's name to find your specific plan design. Local retirees without Medicare will have a choice between a local plan design that includes coverage in the state of Wisconsin or Access Health Plan that includes nationwide coverage and out-of-network benefits at a higher premium. Choosing a Medicare plan design determines how much you pay per month, whether you can see providers locally or nationwide, and could supplement coverage for services not traditionally covered by Medicare, such as hearing aids. Retirees with Medicare have 3 plan design options that increase in monthly costs depending on the coverage you choose. Medicare Advantage has nationwide coverage. It helps pay for hearing aids, routine hearing and vision exams, and durable medical equipment not covered by Medicare. It has one health plan available. Medicare Plus has worldwide coverage. It only helps pay for items partially covered by Medicare. It has one health plan available. Health Plan Medicare has local, county-based coverage. It helps pay for hearing aids, routine hearing and vision exams, and durable medical equipment not covered by Medicare. It has several health plans available to choose from. All 3 plan designs include emergency care and urgent care coverage out of network. You may choose from 3 Medicare options to cover you or your family. The first option is Medicare Single for covering an insured member on a single plan enrolled in Medicare Parts A, B, and D. Medicare All is family coverage where all insured members are enrolled in Medicare Parts A, B, and D. All insured members have the same health plan. Medicare Sum is family coverage with at least one insured family member enrolled in Medicare Parts A, B, and D. If you choose the Health Plan Medicare plan design, all insured members will have the same health plan. If you choose Medicare Advantage or Medicare Plus, non-Medicare insured members can select a different health plan. To choose or change your health plan, go to the Benefits Available to Me page by clicking Benefits, then click Benefits Available to Me. Type in a keyword from your last employer's name. For example, use Trust for the Department of Employee Trust Funds or Madison for the City of Madison. Click the Health Plan card. It will start with the word State or Local. Scroll down a little bit to Health and click the Retirees card. Scroll down to Getting Started and click Health Plan Search. Use the filters on the left side of the search page to narrow down your results by county or state, coverage area, local or nationwide, and plan type, non-Medicare or Medicare. Click on the name of the health plan or its logo to be taken to the plan's information page. Each plan design includes a list of service areas, counties and/or states, and health systems, services, provider directory, contact information, and the plan website link. Pharmacy is a uniform benefit included with all health plans. Each covered prescription drug falls into one of the 4 cost-sharing levels. The lower the level, the less you pay. Level 1 has the lowest cost and consists of generic prescription drugs. Level 2 costs a bit more for preferred brand name drugs. Level 3 consists of non-preferred drugs. These are brand name drugs that are not included on the plan's formulary, which is their list of preferred prescription drugs. Non-preferred brand name drugs have higher coinsurance than preferred brand name drugs. And lastly, Level 4 drugs are high-cost specialty drugs that require special handling, administration, or monitoring. These drugs treat complex and chronic conditions such as rheumatoid arthritis or cancer. Go to the Navitus ETF website or log in to Navitus's website to see your health plan designs formulary. You must fill your prescriptions at an in-network pharmacy. To find a pharmacy and covered drugs for your health plan, go to the Navitus ETF website. Select your health plan design. Find an in-network pharmacy by selecting Pharmacy Search from the menu. You can also find covered drugs for your health plan by selecting Formulary from the menu. Use the Navitus website to find the exact cost of your drugs at different pharmacies. Go to navitus.com, select Members, and log in to the member portal. Sign in with your user ID and password. If you are new to the website, select Register Now to set up an account. You will need your Navitus ID card handy so that you can put in your member ID. Once you are logged in, select Drug from the top menu and select Find a Drug from the drop-down menu. Look to the related resources on the right side of the page to find a PDF of the presentation slides used in this video. You will also find links to pages and other resources you may find helpful. Stay connected to ETF. Get up-to-date information about your WRS benefits by subscribing to ETF email updates, talking with a benefit specialist, going to our website, or subscribing to one of our social media sites.